Dear colleagues, I'm Christoph Diener from the University of Duisburg-Essen in Germany. And what I would like to do this month is to pick out highlight papers which were published in 2021 in neurology. I start with January. We had a study published from the United Kingdom for the treatment of fatigue in patients with multiple sclerosis, a phenomenon which is observed in between 25 and 50% of MS patients. In a crossover study, the investigators compared amantadine, modafinil, methylphenidate, and placebo, and unfortunately none of these treatments was superior to placebo. In February, we had the published results of a study in early Alzheimer's disease with donanemab, a monoclonal antibody against beta amyloid, and this study was positive for the primary endpoint. But the absolute effect of therapy was very small, and we have to wait for more, hopefully, positive studies. In March, we had a spectacular paper from Mannheim and Heidelberg in Germany. These investigators developed a vaccine against an epitope in gliomas. This was only a small open study, but this is a totally new way to hopefully treat gliomas in future. In April, the results of the SANAD studies in epilepsy were published. These are very pragmatic open trials where people are put on anti-epileptic treatment and then the observers see how well is it effective and how many patients terminate due to adverse events. And for focal epilepsy, in these studies, lamotrigine was superior to levetiracetam and zonisamide, and in generalized epilepsy, valproic acid was superior to levetiracetam. But remember, valproic acid is contraindicated in women at childbearing age. May saw a study from the United States in veterans, 1.5 million veterans that were followed for a long time, and they looked for predictors of Parkinson's disease. And what they found is that 15 years prior to onset of the disease, there are GI symptoms like obstipation and smell disturbances, genitourinary symptoms like sexual dysfunction and urinary dysfunction, and prostate hypertrophy. This might help in future to identify patients at risk for Parkinson's disease and include them in studies on neuroprotective therapy. June saw an important study from the Whitehall study. They followed 8,000 participants for 25 years, and they found an association with the duration of sleep and the risk of dementia. So if people slept less than 6 hours per night, there was an increased risk, but if they slept more than 7 to 8 hours per night, there was also an increased risk. By the way, a similar association between duration of sleep was found for the risk of vascular diseases, including myocardial infarction. July saw a study from the Netherlands with occipital nerve stimulation for the treatment of refractory chronic cluster headache. And this study in 150 patients was positive, but this is a surgical procedure which should only be done in very experienced neurosurgical centers. August saw an important study about the question whether neuroimmunotherapy therapy in early multiple sclerosis should be aggressive with highly effective drugs, or whether you should start with more mild therapy and then step up, which is called a stepwise therapy or treatment escalation. The investigators compared 2,700 patients from Sweden, where usually a more aggressive way is followed, with 2,000 from Denmark, where usually treatment escalation is done if mild therapy doesn't work. And the patients in Sweden had a better prognosis with less disability. And this would be perhaps an argument to start with more aggressive therapy, but this also has more adverse events. Now, September saw a study about the risk of neurodegenerative diseases, including dementia, Alzheimer's disease, and ALS in professional soccer players. And these players clearly have an increased risk. This is particularly true for defenders, and the risk is associated with the career duration. Now, this has also been shown in the United States for not only for soccer, but also for ice hockey and football. Now, what are the consequences for amateur sports? I don't know, but perhaps children up to an age of 14 should not do headers if they play soccer. Now, October saw a study in 7,900 patients from a large MS registry. And this study clearly showed if people with MS who are smokers stop smoking, this has a positive impact on the course of the disease. And November saw a meta-analysis on the cases of cerebral sinus venous thrombosis after COVID-19 vaccination. Now, all of these patients were vaccinated with vector vaccines like AstraZeneca and Johnson & Johnson, and there are basically no cases with BioNTech or Moderna. And the pathophysiological mechanism is the development of antibodies against platelet factor 4, and this leads to thrombocytopenia and venous thrombosis. So if a patient develops headache after vaccination, for example with AstraZeneca, you should measure thrombocytes in plasma. Ladies and gentlemen, 2021 was an exciting year in neurology, and this is only a small and very subjective selection of important papers from this year. Thank you very much for listening and watching.